So there's a lot of black market drugs being sold on the market. The price is too low. It's too good to be true. That basically are signs of anaphylaxis. So we have something called adrenaline. We would give that to you and we'll call the ambulance as well. It is very easy. It's very easy for you to fall down that route.
Anti-wrinkle treatments, do's and don'ts. I'm your pharmacist working in the pharma industry, and I've been making a series on trending treatments, what you should know. And today we have Dil, who's a pharmacist but also an aesthetic practitioner, who's going to be walking us through of her experience as a practitioner.
Today we'll be taking you on a journey on how patients can make informed decisions before booking any type of aesthetic treatments.
So let's move on to side effects. What side effects are normal and what have you seen as a practitioner?
What I normally see is a lot of patients do tend to get small little bumps on the injection site. Sometimes they can get quite irritated, be a little bit like they can get quite red as well, which is very normal, and they do tend to go down by 20 to 30 minutes of the treatment. But you can also get things like bruising, usually more common in those that are anemic or have iron deficiency, and get a little bit of swelling but not a lot. Now, if you notice there is quite a lot of swelling on the forehead, that's not normal, so it shouldn't really be happening. If you've got any difficulty in breathing, if you've got any blurred vision or any like vision abnormalities which is not normal to yourself, that's again, a side effect that you should be talking to your practitioner about or seeking medical help.
Right. And what can you as a practitioner do at the time of them getting these injections and you see that there are side effects?
So we have obviously things in place. We do see something like if they're getting a reaction from the Botox, we have something called adrenaline, which is EpiPen. I'm sure a lot of people are aware of it. We would inject that into you. If we notice that you've got difficulty in breathing, any swelling in the lips, if you're not yourself, and we can see that basically are signs of anaphylaxis, we would give that to you, and that would probably just mean that it will calm you down, and we'll call the ambulance as well just to make sure you're safe. Now, that hasn't really happened to me.
Yeah.
I hope it never does. But there are practitioners that I've spoken to and it has happened to them. Usually doesn't occur with anti-wrinkle, most commonly occurs with fillers. But with fillers we would do like a patch test before we actually inject into the area that we're injecting into, basically. So we'll do like a small patch test, make sure that's okay for you, and then we'll go ahead and inject where we're needed to inject.
That's great. And I guess that's where it's important where a proper trained practitioner comes into place.
If you are going for fillers, for example, and you're basically being told, okay, let's get on with the treatment without a patch test, that is the biggest red flag. You just make sure you just walk out from there.
Got you. Who shouldn't be getting anti-wrinkle treatment?
Obviously, if you're pregnant, if you're breastfeeding, we don't do treatments, any aesthetic treatments on pregnant women or breastfeeding women. We also make sure that if you've ever had an allergic reaction, so any anaphylactic reaction previously to, say, a toxin, we would never inject that into you. And obviously, if you've got any neurological conditions as well. So obviously, that's why it's important we go through your medical history. So it's always about safety first.
Of course. Yeah, that's great. Have you ever advised someone not to get these anti-wrinkle treatments?
Yeah, that's very common, to be honest with you, because a lot of people nowadays see a lot of social trends on social media and they feel like, they can come in, they'll bring in pictures and they obviously want to look just like them.
You've had that?
Yes. It's not possible. It's just like going to a makeup artist. You cannot show them a picture and tell them you want to look like this, but you have different features, you have different facial anatomy. It's just not possible for us to do that. So if I feel like it's not going to meet the patient's expectations, I will say no. Obviously, anyone that's pregnant and breastfeeding, obviously no. And then obviously anyone that's got neurological conditions as well, that would be a no. And things like if, for example, you came in and you said, I want this done, how likelihood is it that it's something that would suit me? I would be very, very real to you. I will tell you, look, this isn't something that's for you. You don't need it. I will never do a treatment just because a patient is telling me that they want this treatment. I'll make sure that this is something that will suit you and will be beneficial to you. There is no point me giving you a treatment if at the end of it there are no results, which will make you unhappy and obviously make me feel unsatisfied of not providing you with what you asked for.
Of course, and that's a good sign of being a practitioner.
Of course,
to be able to say no.
Yes, yeah. I feel like a lot of practitioners they feel obliged to say yes. I think now a lot of them are now realizing that actually if it's something that's not going to be beneficial for the client and if it's something that's not going to suit them, you just have to say no, because at the end of the day, they're just going to turn around to you and say, well, you know, you didn't say anything when you had this consultation. So that's why, again, you need to make sure that you've gone through a thorough consultation before that injection goes onto your face or anywhere else, wherever you're getting the treatment, basically.
Right. Yeah. Okay. Then we know. So if someone has a complication after treatment elsewhere, what should they do?
First point of contact would obviously be their practitioner, because they've obviously known what they've done, what treatment they've had done, and they obviously know about the entire medical history of the patient. However, there are chances that sometimes practitioners might not be available. So if it is something which the practitioner has mentioned to you, and if you feel like that is one of the more serious side effects and the practitioner is not available, I would probably say seek medical help, go to A&E, call the ambulance, or whatever you need to do just to make sure you're looked at quite quickly.
And that's an important one. Can you walk us through how a first appointment looks like at your clinic?
You can obviously give me a call. You can directly contact me through Instagram, TikTok, or through our website, basically. We will get into contact with you. We will discuss your treatment with yourself. We'll obviously go through a thorough consultation, which includes your medical history and if you're on any types of medications that might interact with the treatment that you're having done. And then we would give you examples of what would suit you. A lot of patients would come with focus on what they want done, but it's my responsibility to then shift them from that focus and give them the treatment that will, benefit them the most.
Right.
There's no point me basically going through that consultation and agreeing with everything that the client wants. Of course, there are a lot of, no one's going to come to a practitioner and trust a practitioner with their face just like that. I'm sure everyone does their research, but this is where the practitioner comes in, and it's very important you listen to them. If they are the right practitioner, they will make sure they give you the treatment that will give you the most beneficial results.
Right. Is there anything that you would want to relay to patients or people considering these treatments?
I'll give you an example myself. Before I was a practitioner, it took me a long time to kind of figure out who I want to go to. I did my research, and obviously I have had some of the treatments. I'm not going to lie about them. I have had some treatments basically, and I've chosen my practitioner very carefully. I've made sure I've looked at the reviews, I've looked at, their before and afters, and then I've gone with them. I feel like a lot of clients want treatments done, but they are very, very scared to approach practitioners. And because the industry is so saturated, there are so many people doing this as probably their part-time job, for example. It's very difficult to choose the right practitioner. So I feel like, honestly, you don't have to book a treatment with me if you just need if you need some information, if you need just a consultation, you're more than welcome to just contact me, and I will obviously go through the consultation with you properly, and then that's your choice whether you want to book a treatment with myself or not. It doesn't mean because I'm giving you a consultation you need to book with me. I feel like that's where the main problem is. A lot of practitioners do tend to take consultation charges and things like that. I don't do that. I just feel like it's very important for patients to know what they're getting done.
And that they feel safe.
And they feel safe, yeah. So like I said, like for me, that was one of the biggest factors. Like everywhere I contacted, we charge this much for consultations, this and that. And I felt like, no, this should be part of the whole process. I don't charge for consultations. And if I feel like you don't want to book with me, that's okay. If you want information and if you just want that confidence, I'm here to help as well. So
right. Yeah. Do you inform your patients about possible side effects and then how they go about reporting them later on?
Yeah, so before we actually do any treatment, so once I've had that consultation with you, we would send out forms. So those forms would obviously include all your personal details. You would sign them for me, send them back to me. So we've got them on record. Within those forms would be all common side effects, uncommon side effects. So you're fully aware of what you're getting yourself into. So there's no problems afterwards to say, you didn't inform me or I didn't inform you. So you'd be informed with everything. Now, the first point of contact, like I said, would be myself.
Are you available 24/7 though?
I am not available 24/7, but like I said, that's where A&E comes in. That's where the emergency services comes in. And obviously, I feel like a lot of people don't know. So, for example, if you get one of the side effects that's not so common, that's not so uncommon, and that's not listed in a treatment, then there's obviously a different way of reporting those side effects to kind of help patients in the future that are likely to get those side effects, because maybe that side effect hasn't been studied.
Right.
So I think that's where your expertise comes in.
Side effects and reporting.
Yes. So I think that's where your expertise comes in, and I think it would be a very good idea for you to explain to everyone what they should do in terms of oh, what should I do actually?
Yeah.
You know, because you come from the industry, pharmaceutical industry, so it'll be very good for me to know as well, like, how can I basically get my patients to kind of report these side effects that are not so common and that are not studied in a certain treatment.
Right. And we obviously classify anything that they experience, patients,
Yeah.
whatever they experience, such as bruising, it could be a minor thing, it could be a major thing, it's still required to be reported.
Yeah.
And patients are encouraged to report these side effects. So a lot of my videos are now focusing on side effects because people are not aware that they can report these. And if so, where do they report it?
Okay.
I'm sure you have your brand that you use for any product that you have.
Yeah.
In that, you may also have a patient information leaflet. And in that, you will find who the marketing authorization holder is and contact details as well. That's where you call in and you basically give brand name, batch number, expiry date, patient details, and any possible side effect that the patient may have experienced.
Okay.
That's how you as a practitioner can report it, but also the patient can get the same information, same contact details, and they could report it.
Okay, so just for my understanding, is it any side effect that they get, or is it those that are quite uncommon?
Any
side
and it doesn't have to be just uncommon side effects.
Yeah.
It could also be common ones that are listed in the patient information leaflet. Yeah.
Perfect. So, you know, I've learned something from this as well. So I always thought maybe you're reporting those that are not listed in, say, the information leaflets, or those that are quite uncommon. I didn't know that you can practically just, you know, report any, even the common side effects.
Right.
Because it gives you, as a, you know, industrial pharmacist, to kind of figure out, you know, how many people this is kind of affecting, and if it's something that kind of needs to, if the drug needs to be looked into. If it is, so for example, say if it's affecting a lot of people, is there something that you would do about that drug, or is it?
So I could give a very common example. That's COVID-19 vaccines, right? We were seeing a lot of cases that were out there, patient experiencing stroke, possible TIA, and that's where people were encouraged to report these. Practitioners were reporting this, and then just that we don't have enough data from patients, because you could do your clinical trials and then you do it on your healthy individuals and maybe a limited population, but then when it comes out in the market, there is different people.
So this probably gives you a better understanding of how a drug's working and the potential.
It's a legal requirement to have that. So if any drug is out there that includes anti-wrinkle treatments, if they've been approved to be put on the market, they have to be monitored throughout their life cycle. That's where drug safety comes in, and then whatever reports we get is basically we do a trend analysis, how is it going, and that's what allows the marketing authorization holder, basically the company who's put the product out there, to continue marketing that and selling that. So it's
I think this then leads on to another thing in the practitioners side of the world. So there's a lot of black market drugs being sold on the market. Obviously, I have a lot of clients that come to me and say, oh, well, why is your price this much? I'm going to get it for this much. You know, what they don't realize is if the price is too low, it's too good to be true. And they're not using authorized products. They are using products that are probably coming from the black market, which are costing them probably pennies, and they're making a lot of money out of you, you know, still. So this is why, again, you need to make sure you kind of speak to the practitioner, ask them what they're using exactly, and please don't go to places that are offering you anti-wrinkle injections for, say, 60, 70 pounds. We don't even, that's not even our cost price. So you really need to make sure that you're looking at the prices. Yes, a lot of practitioners do charge a lot as well. I'm not saying they don't, but go somewhere where you kind of match the prices and it looks like an average. You're not, if someone is giving you an anti-wrinkle injection for 60, 70 pounds, please don't go there. Definitely, they are not using the right product. You will end up getting little to no result, and probably side effects from it which haven't been studied in that product, because obviously you don't know where that's coming from.
And also how the practitioner is using those products, in the sense, are they qualified enough? Like, do they have that ethical obligation to even go ahead and...
So with myself, if you come to get treatment from myself, all of the products that are, for example, specifically anti-wrinkle injections, they are prescribed just for you. So if you come to me, I can show you that the item has actually physically come in from a pharmacy, which has been signed and clinically checked by a pharmacist, and it's named to you only. So, you know, if you've got practitioners that are kind of using say anti-wrinkle injections and things like that on the sly without actually giving you the ability to speak to a prescriber. So what happens usually is when we do this consultation, you're happy that you want to go ahead with the treatment, we would obviously send off your forms to a prescriber. The prescriber then would look at everything, including your medical history, and make sure that's suitable treatment for yourself. Only then they will accept and issue a prescription to the prescribing pharmacy.
Right.
The prescribing pharmacy would then send it to myself with your details and everything on it. So I will then have that on file for the rest of your life, basically, or my life. That it will be on record, basically, in case anything arises, in case any problems do occur, it's there for proof. So if a practitioner cannot give you those things, give you those details, and give you that proof, I'm sorry, they're not doing it correctly.
Wow, that's an important one, I think.
So you really need to make sure that the items are actually directly coming from a legitimate source.
Right. Yeah. And that's one of the things where we come in. One of the things we do in the quality and compliance sector is to monitor that nothing is out there that is a possible counterfeit. Yeah. It's very important that we're informed about this. That's the main point. The reason why we're doing this is also for patients to be informed so that they can take their informed decisions. Yeah. Are you aware of how common it is to get these products in the black market?
To be honest with you, we are on TikTok. I have had a lot of people message me on TikTok. I probably will get grilled for this, but it's okay. It's very important for us to inform everyone outside. I had a lot of people contact me, message me, and give me these products, which I don't need to pay prescriber fees to. Oh wow! So we're paying around £25 just for a pharmacist to just check off an item per prescription. So I cannot order 2 anti-wrinkle injections for you. I would have to order that 1 treatment worth. Basically, they will not allow me to order 2 because, clearly I could be using that for someone else. Yeah. So they're very strict like that now with anti-wrinkle injections. So we pay those prescribers that money to make sure it's safe for yourself. Okay. So again, like I said, I have had a lot of people actually contact me and, provide me with information that, they are CE marked and all of this. But to be honest with you, unless I'm satisfied, because I'm a pharmacist as well, I cannot let my registration go downhill just because of using counterfeit products.
And that's where it's very important for a healthcare professional to step in and practice and handle with patients because they know the entire supply chain. Of course. How do you order it? How do you get it?
It's very easy to fall down that route. It's going to make you more money, right? So honest with you, it is very easy. It's very easy for you to fall down that route and be like, okay, you know what? I'm getting this product for this much, whereas I'm going to be getting it for this much from a pharmacy. Why don't I just go for that and use it? But that's exactly, where if you do use the right practitioner, they will make sure they don't use it. For myself, for example, I would never be able to use counterfeit products because it's basically putting a risk to my registration and it's just not ethical for me. If I'm treating a patient, I need to treat them with the correct items. Otherwise, I am the one who's going to be responsible for any side effects or any serious harm that's caused to the patient, basically. So it's very easy. I'm not going to lie. It is very easy to just be able to get those products for cheap, make more money. Yeah. But then what you face afterwards, the consequences, they're not nice. So.
And I believe a lot of the people who do practice in that way, they wouldn't even care about patient safety to begin with.
No, I think people that are just coming into this business who think that it's all about money. It's not. You are continuously investing into learning with this business. Yes, it can make you money, but at the end of the day, that money you're then using to invest into, say, courses. There is something new coming up, with skin treatments, with body treatments, everything. There is something coming up every month, every 2 months, So we're continuously having to invest that money into something else. So a lot of people think aesthetics, money. Yeah. It definitely isn't that way. And if you're using the correct products, it's definitely not making you a lot of money.
It's hard work and skill set that you need alongside. Yeah. And I think, again, we come back to the part where healthcare professionals, where they need to conduct these procedures on patients directly and not just anyone coming in and doing these procedures.
Of course. I'm not saying healthcare professionals are the best at these treatments. Yes, they have a lot of background knowledge. that they can use from, you know, their jobs, their careers into this.
Yeah.
But there are practitioners out there that have zero experience in this industry but are doing really well. You know, their results are amazing, their before and afters are amazing, their reviews are amazing, you know. So I wouldn't say that healthcare professionals are the only ones that you should go to, but yes, go to someone that you know has legitimate sourcing of these products, has good reviews, and is going to take you for a thorough consultation before doing this treatment, making sure that, you know, it's safe for yourself. For safety first in anything you do.
Of course.
That's my biggest concern with practitioners.
And staying informed.
Of course.
Our end goal with this,
Yeah.
that we inform our patients, but we also think about what you actually do in the background, because a lot of people don't even know that you send out forms. So and the reason why you do that is to be able to make that assessment whether they're eligible for these treatments or not.
Yeah. So like I said, it's not just myself that is kind of saying, okay, yes, I'm going to do this treatment. You will get those practitioners that will not send off your forms across to, say, a prescriber, that will not get legitimate sources or treatments from a pharmacy. They will probably come from just a supplier that they know.
Yeah.
And then they will just charge you less for it, because obviously they're getting it for less. They're not paying any fees. So like I said, this is, I think safety is the major concern right now in aesthetics, and this is why they're pushing everyone to do the level 7 aesthetics course, because that will give you, whether you're a medical professional or not, that will give you the highest qualification in aesthetics.
Okay.
Yeah.
If they have any questions, they can come to you directly on
YouGlowAesthetics. So we have different pages. I'll get Kajal to just link them down for you. You can directly DM us, or you can DM in the post Kajal's going to be posting.
Thank you so much, Del, for walking us through and patients staying informed with you. I'm sure people have learned a lot from you today, and thank you.
I would like to say a big thank you to you too. It was a pleasure to have myself here and actually learn a lot of things from yourself too.
Thank you.
So thank you, and
stay informed with us.